गल करते हैं कैनेडा की BC की सूबाई सेहत अधिकारी डॉक्टर बोनी हैनरी ने BC विच कोरोना वायरस के 45 नवे केसां की पुष्टि की है। इस दे नाल सूबे विच पीड़ितां की कुल गिनती 231 हो गई है। एक न्यूज़ कॉन्फ्रेंस में डॉक्टर हैनरी ने कहा कि वैनकूवर के रिहायशी देखभाल वाले हाउस हारो पार्क सेंटर में एक नवा केस आया है। 13 पीड़ित लोगों को हस्पताल दाखिल करवाया गया है, जिन्हां विचों 7 ICU विच इलाज अधीन ने। 5 व्यक्ति ठीक हो रहे हैं। उन्होंने लोगों को भावनात्मक अपील करदे कहा कि आइसोलेशन को गंभीरता नाल लिया जाए। सेहत अधिकारी के अनुसार ताज़ा स्थिति इस तरह है कि वैनकूवर कोस्टल हैल्थ विच हुण 144, फ्रेजर हैल्थ विच 58, वैनकूवर आइलैंड लई 16, अंदरले हिस्से विच 9 और उत्तरी वैनकूवर विच 4 व्यक्ति कोरोना वायरस तो पीड़ित ने। हैनरी ने कहा कि सानू सारिਆਂ ਨੂੰ जागरूक होने की जरूरत है, क्योंकि ये जोखम सिर्फ एक जगह तक ही सीमित नहीं है, तो सानू हर थां तो इस तो बचाव लिए उपराले करने की लोड़ है। उन्होंने चेतावनी भी दी कि हुण कोई भी ये ना सोचे कि इसका मेरे ते कोई असर नहीं पवेगा। उन्होंने कहा कि अगले 7 तो 10 दिन इस वायरस के प्रकोप को घटाने लिए बहुत ही महत्वपूर्ण है। ओंटारियो के सेहत अधिकारियों वालों प्रेस कॉन्फ्रेंस की गई, जिन्हें दस्सिया कि कोरोना वायरस नाल प्रभावित एक मरीज की मौत हो गई है। मृतक 77 साल का व्यक्ति सी। अधिकारियों के मुताबिक ठोस कदम चुकने की जरूरत है, क्योंकि पिछले हफ्ते केसां की गिनती बहुत तेजी नाल वधी है।
Today, also, I'm sad to announce that we've had our first death potentially related to COVID-19, and that tells us that, you know, while we haven't had any so far, it is a possibility we have been expecting to deal with during this time. So it's not unexpected. But it's still a person and with a family and friends, and we offer condolences onto the family on that, because it still is a loss. And sometimes in some of these large events we lose track of that. We want to make sure we remember that. Also, the number of cases in Ontario has risen rapidly. And over the weekend, we noticed that the cases moved from almost doubled from 70 to 80 up to 170, and that was a rapid rise. And Dr. Yaffe will talk somewhat about those numbers here in a moment, and how those are looking at this time. And so with that in mind, combined with working with our consultants and with the different scenarios that we had studied and looked at with modeling, and in consultation with peers across the country, as each of us are dealing with it in our own way, but in similar ways, and the challenges that are there, a number of steps were taken. But before we get into those details about what the media announcement this morning was on that, I'm going to ask Dr. Yaffe to talk about some of the numbers as we see it, and how that's evolving, and what direction it indicates that we're moving in at this time.
तो उधर ओंटारियो के प्रीमियर डग फोर्ड वालों प्रोविंस में स्टेट ऑफ एमरजेंसी ऐलान दी गई है, जिस के तहत 31 मार्च तक 50 तो ज़्यादा लोगों की गैदरिंग वाले सारे प्रोग्राम रद्द कर दिए गए हैं। प्रीमियर वालों पब्लिक लाइब्रेरीज, प्राइवेट हस्पताल, सिनेमा हॉल, रेस्टोरेंट और चाइल्ड केयर सेंटर को बंद करने का हुक्म दिता गया है, और खाना भी घरों में डिलीवर किया जा सकता है। उन्होंने कहा कि ग्रोसरी स्टोर, फार्मेसी, पब्लिक ट्रांजिट, कंस्ट्रक्शन का काम चलता रहेगा।
This morning, I've declared a state of emergency in the province of Ontario. We're facing an unprecedented time in our history. This is a decision that was not made lightly. COVID-19 constitutes a danger of major proportions. We're taking this measure because we must offer our full support and every power possible to help our healthcare sector fight the spread of COVID-19. The first order under this declaration will be the prohibition of organized public events of over 50 people, including parades and events and services within places of worship until March the 31st. Secondly, the following establishments are closed effective immediately until March the 31st. All facilities providing indoor recreational programs, all public libraries, all private schools as defined in the Education Act, all licensed child care centers, all bars and restaurants, except to the extent that such facilities provide takeout food and delivery. All theaters, including those offering live performances of music, dance, and other art forms, as well as cinemas that show movies and concert venues. Again, this order will come into effect immediately. I want to be very clear about what this means and what this doesn't mean. This is not a provincial shutdown. I repeat, this is not a provincial shutdown. The vast majority of businesses, including those most vital to day-to-day life, will not be affected by this order. Essential services and essential needs will be available to every individual and family. Groceries, convenience stores, pharmacies, manufacturing facilities, public transit, important public services, construction sites, office buildings will all continue to operate. Right now, we need to do everything possible to slow the spread of COVID-19 in order to avoid overwhelming our healthcare system.
ਪ੍ਰੀਮੀਅਰ ਫੋਰਡ ਨੇ ਕਿਹਾ ਹੈ ਕਿ ਕੋਵਿਡ-19 ਨੂੰ ਫੈਲਣ ਤੋਂ ਰੋਕਣ ਦੇ ਲਈ ਇਹ ਕਦਮ ਚੁੱਕਣੇ ਜ਼ਰੂਰੀ ਸਨ। ਇਸ ਵਿੱਚ ਦੇਰੀ ਨਹੀਂ ਕੀਤੀ ਜਾ ਸਕਦੀ ਸੀ। ਪ੍ਰੀਮੀਅਰ ਨੇ ਕਿਹਾ ਹੈ ਕਿ ਲੋਕਾਂ ਦੀ ਸੁਰੱਖਿਆ ਲਈ ਇਹ ਕਰਨਾ ਜ਼ਰੂਰੀ ਸੀ। ਪ੍ਰੀਮੀਅਰ ਨੇ ਵੀ ਕਿਹਾ ਹੈ ਕਿ ਫੈਸਲਾ ਚੀਫ ਮੈਡੀਕਲ ਅਫਸਰ ਅਤੇ ਡਾਕਟਰਾਂ ਦੀ ਸਲਾਹ ਦੇ ਨਾਲ ਹੀ ਲਿਆ ਗਿਆ ਹੈ। ਉਹਨਾਂ ਦੇ ਮੁਤਾਬਕ ਉਹ ਇਸ ਸਮੇਂ ਵਰਕਰਾਂ ਦੇ ਨਾਲ ਖੜੇ ਨੇ ਅਤੇ ਫੈਡਰਲ ਸਰਕਾਰ ਨੂੰ ਵੀ ਅਪੀਲ ਕਰਦੇ ਨੇ ਕਿ ਓਨਟਾਰੀਓ ਦੇ ਲੋਕਾਂ ਦੇ ਨਾਲ ਖੜੇ ਅਤੇ ਬਿਜ਼ਨਸ ਅਦਾਰਿਆਂ ਲਈ ਲੋਨ ਪ੍ਰੋਗਰਾਮ ਲੈ ਕੇ ਆਵੇ।
The health and well-being of every Ontarian must be our number one priority. We must think about our children, our parents, and our grandparents. We must think about our neighbors, our colleagues, and our friends. We must think about the elderly, those with health issues, and every other person across this province. All of these people have been in my heart and on my mind with every decision I've made during this crisis. It is imperative we protect every person and every family across this province. We must act decisively and we must not delay. As COVID-19 continues to spread, the government must be in a position to take any and all actions necessary. That is why today, Ontario has declared a state of emergency. As I've said all along, we've been preparing for every scenario. This decision was not made lightly. It was based on the advice of our Chief Medical Officer of Health and public health officials. Our cabinet deliberated late into the night and again very early this morning. As we take action to fight the spread of this virus, I want to assure the people of Ontario their government is taking every step possible to flatten the curve. We're taking the steps necessary to protect you and your loved ones. We're taking these measures now while our system is strong and to ensure it remains strong in the days and months ahead. I want to urge calm across the province. No expense will be spared to support Ontarians in need. There's no level of support we won't consider. By declaring a state of emergency, our province will be in the position to act as fast and decisively as needed. Again, this decision was not made lightly. We've seen around the world that jurisdictions like Ontario, who take timely and decisive action, have so far stayed ahead of this virus. We must flatten the curve and help stop the spread of COVID-19. We understand this decision will impact workers across this province. My message to these people is that we will support you during these difficult times. We expect the federal government to support Ontarians with the following measures. They must work with us to establish a loan program to support businesses. Immediate EI reforms must be implemented to support workers.
ਇੱਕ ਦਿਨ ਵਿੱਚ 83 ਮਾਮਲੇ ਸਾਹਮਣੇ ਆਉਣ ਤੋਂ ਬਾਅਦ ਪ੍ਰੋਵਿੰਸ ਵਿੱਚ ਪਬਲਿਕ ਹੈਲਥ ਐਮਰਜੈਂਸੀ ਘੋਸ਼ਿਤ ਕਰ ਦਿੱਤੀ ਗਈ ਹੈ। ਉਹਨਾਂ ਕਿਹਾ ਕਿ ਪਿਛਲੇ ਦਿਨਾਂ ਤੋਂ ਕੇਸਾਂ ਦੀ ਗਿਣਤੀ ਵਧ ਰਹੀ ਹੈ। ਇਸ ਦੇ ਲਈ ਟੈਸਟ ਕਰਨ ਦੀ ਰਫ਼ਤਾਰ ਵੀ ਵਧਾ ਦਿੱਤੀ ਗਈ ਹੈ ਤੇ ਦੂਜੇ ਮੁਲਕਾਂ ਤੋਂ ਆਉਣ ਵਾਲਿਆਂ ਨੂੰ ਟੈਸਟ ਕੀਤਾ ਜਾ ਰਿਹਾ ਹੈ ਕਿਉਂਕਿ ਜੇਕਰ ਉਹਨਾਂ ਵਿੱਚੋਂ ਕੋਈ ਵੀ ਪ੍ਰਭਾਵਿਤ ਹੈ ਤਾਂ ਉਹ ਕਮਿਊਨਿਟੀ ਵਿੱਚ ਇਸ ਨੂੰ ਨਾ ਫੈਲਾਏ। ਡਾਕਟਰ ਹੈਨਰੀ ਨੇ ਕਿਹਾ ਕਿ ਇਸ ਸਮੇਂ ਪੂਰੀ ਦੁਨੀਆ ਵਿੱਚ ਰਿਸਕ ਹੈ ਤੇ ਇਹ ਵਾਇਰਸ ਦੁਨੀਆ ਦੇ ਜ਼ਿਆਦਾਤਰ ਦੇਸ਼ਾਂ ਵਿੱਚ ਫੈਲ ਚੁੱਕਾ ਹੈ।
Today, in addition, we have taken the extra step of declaring a public health emergency in the province of British Columbia. This is something that, as you know, we've had it as a tool in our toolkit for some time, and I felt that today was the tool. This is the tool that we need now. We've taken a number of unprecedented measures in the last few days, and this declaration of an emergency enables me to be faster, more streamlined and nimble in the things that we need to do right now. To go back again to the numbers, and then I'll talk a little bit about, there's a large increase, and it really is not reflective of just the number of people who tested positive in the last 24 hours. As we've been talking in the last few days, we've had a dramatic increase in numbers of people going for testing and numbers of people being tested, as well as expansion of testing to 5 different sites in the province, and more are coming on board. So this is a reflection of a number of people who were identified in those other sites, particularly St. Paul's and VGH, where the testing was presumptive positive at those places and then had to come into the BC CDC for a second confirmatory test. So there was a delay in getting the second test and the confirmation and the numbers then getting into our official provincial reconciliation, if you will. So in the meantime, the people who had tested positive over the last number of days from St. Paul's or from VGH were notified of that. Public Health was aware that these were presumptive positive, and the important actions to try and prevent transmission and to support people in isolation were all being taken. We are going to see that change over a period of time. So a big step up today as they tried to reconcile all these numbers. And there's a backlog of cases as well that we are managing over the next little while with that confirmatory testing at the BC CDC. So we're likely to see those numbers increase in the next few days as well. And this is in keeping with the testing strategy, our new testing strategy that we've moved to. And as we've always said, the first line of defense is testing. And as you know, we started with a strategy of testing broadly in the community because we needed to determine people coming in from other countries who were carrying this disease and could potentially spread it to others in our communities. We now know that all areas of the world really are at risk, and that this virus has been circulating in many areas around the world.
ਪ੍ਰਧਾਨ ਮੰਤਰੀ ਜਸਟਿਨ ਟਰੂਡੋ ਨੇ ਕਿਹਾ ਹੈ ਕਿ ਜੋ ਮੁਲਕ ਵਿੱਚ ਵਾਪਸ ਆਉਣਾ ਚਾਹੁੰਦੇ ਨੇ ਉਹਨਾਂ ਦੀ ਵਿੱਤੀ ਸਹਾਇਤਾ ਕੀਤੀ ਜਾਵੇਗੀ ਅਤੇ ਉਹ ਫੋਨ ਲਾਈਨ ਅਤੇ ਈਮੇਲ ਦੇ ਰਾਹੀਂ ਸੰਪਰਕ ਕਰ ਸਕਦੇ ਨੇ। ਪ੍ਰਧਾਨ ਮੰਤਰੀ ਟਰੂਡੋ ਦੇ ਮੁਤਾਬਕ ਕੈਨੇਡੀਅਨ ਵਰਕਰਜ਼ ਅਤੇ ਕਾਰੋਬਾਰਾਂ ਦੇ ਸਹਿਯੋਗ ਦੇ ਲਈ ਮਾਪਦੰਡ ਭਲਕੇ ਸਾਹਮਣੇ ਆ ਜਾਣਗੇ। ਇਸ ਤੋਂ ਇਲਾਵਾ ਟੈਕਸ ਸੀਜ਼ਨ ਵਿੱਚ ਤਬਦੀਲੀ ਅਤੇ ਲੋਕਾਂ ਦੀਆਂ ਅਦਾਇਗੀਆਂ ਵਿੱਚ ਲਚਕੀਲਾਪਨ ਲਿਆਉਣ ਤੋਂ ਇਲਾਵਾ ਬਿਜ਼ਨਸ ਲਈ ਵਾਧੂ ਕੈਸ਼ ਦਾ ਪ੍ਰਬੰਧ ਕਰਨ ਲਈ ਵੀ ਵਿਚਾਰ ਕੀਤੀ ਜਾ ਰਹੀ ਹੈ।
It will help people who need immediate financial assistance return home or cover their needs if they have to wait to get back. Canadians abroad in need of emergency assistance can always call 1-613-996-8885 or email sos@international.gc.ca. This comes as we announce that we are closing our air borders to people who aren't Canadian citizens or permanent residents, with some exceptions like for aircrew and US citizens. Earlier today, the Special Cabinet Committee on COVID-19 met once again to discuss our response. And full Cabinet will have a meeting this afternoon. We are hard at work to create the right support package for Canadians while protecting people's jobs and our economy. And tomorrow, we will be making another major announcement on economic actions to support Canadians as quickly as possible. By the end of the week, we will have more to say about changes for the upcoming tax season. We're looking at giving more flexibility for people to make payments and for businesses to have more liquidity during this time. Throughout this, we're working together right across the country. I have directed the House Leader to engage with his counterparts to discuss a brief return of the House of Commons so that we can bring in emergency economic measures. There are economic pieces that will need quick passage through the House in order to support Canadians. We are also examining the Emergency Measures Act to see if it is necessary or if there are other ways that will enable us to take the actions needed to protect people. Coordination at all levels and between all parties is vital. I have asked the Chair and Vice Chair of the Cabinet COVID Committee, Ministers Freeland and Duclos, to ensure that there are regularized briefings for premiers, leaders of the opposition, and other stakeholders for the foreseeable future. And yesterday, our regular calls with all parliamentarians began, which the Public Health Agency of Canada is moderating. Right now, we must all work together. The bottom line is this: each one of us can make choices that help the people around us. In fact, we can make choices that will save lives.
ਬ੍ਰਿਟਿਸ਼ ਕੋਲੰਬੀਆ ਦੇ ਪ੍ਰੀਮੀਅਰ ਵੱਲੋਂ ਪ੍ਰੋਵਿੰਸ ਵਾਸੀਆਂ ਨੂੰ ਕੋਰੋਨਾ ਵਾਇਰਸ ਵੱਲੋਂ ਪੈਦਾ ਹੋਏ ਹਾਲਾਤਾਂ ਬਾਰੇ ਸੰਬੋਧਨ ਕੀਤਾ ਗਿਆ, ਜਿਸ ਵਿੱਚ ਉਹਨਾਂ ਸਾਫ਼ ਕੀਤਾ ਕਿ ਸਰਕਾਰ ਸਭ ਦੀਆਂ ਨੌਕਰੀਆਂ ਸੇਵ ਕਰਨ ਲਈ ਕਦਮ ਪੁੱਟਣ ਜਾ ਰਹੀ ਹੈ। ਇਸ ਤੋਂ ਇਲਾਵਾ ਪ੍ਰੀਮੀਅਰ ਵੱਲੋਂ ਬਿਜ਼ਨਸ ਕਮਿਊਨਿਟੀ ਅਤੇ ਪ੍ਰੋਵਿੰਸ ਦੇ ਲੋਕਾਂ ਨੂੰ ਭਰੋਸਾ ਦਿੱਤਾ ਗਿਆ ਕਿ ਜਿੰਨੀ ਸਰਕਾਰ ਦੀ ਤਾਕਤ ਹੈ ਉਸ ਹਿਸਾਬ ਦੇ ਨਾਲ ਠੋਸ ਕਦਮ ਪੁੱਟੇ ਜਾਣਗੇ।
And we do want to make sure that we're protecting workers with the changes that we're proposing, but we also understand that bringing the legislature back is inconsistent with some of the other messages that we're giving to the public about not congregating in large groups. We've been working with Dr. Henry and the Speaker's office to find ways, working with the opposition parties, to find ways where we could have a vigorous debate on the changes we're proposing without having to bring every legislator back to Victoria. We could have a quorum of MLAs to debate the issues so the public has a clear understanding of the pluses and minuses, the pros and the cons, but we do not need to have a full legislature to do that. And Minister Farnworth is working, as I said, cooperatively with both of the opposition parties to realize that outcome. Lastly, before I pass the podium over to Minister Fleming, I just want to again reassert the notion that all of us are in this together. We have a cross-government approach to this. We have a cross-province approach to dealing with stakeholders in every corner of the province. Every sector is going to be impacted by this. We're going to need a plan. We're working on that. We have been for weeks now. The opportunity to flesh that out is just a day or two away as we await final decisions by the federal government. This is a crisis situation. There's no making that sound any better. I want to commend those who are taking appropriate actions for themselves and their families and their businesses, and I want to assure them that we are going to do everything in our power to make sure that your employment is maintained or your salaries are maintained. We're going to be talking about rent banks. We're going to be talking about challenges in the financial sector. Again, right across the board, when Minister James and I are reaching out to industry and business leaders, they are foursquare with us and trying to find a way forward for their companies, for their employees and the province. So I'm encouraged by that.
ਬ੍ਰਿਟਿਸ਼ ਕੋਲੰਬੀਆ ਦੇ ਵਿੱਤ ਮੰਤਰੀ ਨੇ ਸਾਫ਼ ਕੀਤਾ ਹੈ ਕਿ ਭਲਕੇ ਪ੍ਰਧਾਨ ਮੰਤਰੀ ਜਸਟਿਨ ਟਰੂਡੋ ਫੈਡਰਲ ਸਰਕਾਰ ਦਾ ਇਕਨੋਮਿਕ ਪ੍ਰੋਗਰਾਮ ਐਲਾਨਣਗੇ। ਇਸ ਦੇ ਬਾਅਦ ਹੀ ਕਦਮ ਪੁੱਟੇ ਜਾਣਗੇ ਤੇ ਬ੍ਰਿਟਿਸ਼ ਕੋਲੰਬੀਆ ਸਰਕਾਰ ਵੀ ਇੰਪਲੋਇਮੈਂਟ ਇੰਸ਼ੋਰੈਂਸ ਨੂੰ ਐਕਸਟੈਂਡ ਕਰਨ ਦੀ ਹਮਾਇਤੀ ਕਰਦੀ ਹੈ। ਉਹਨਾਂ ਕਿਹਾ ਹੈ ਕਿ ਉਹ ਬਿਜ਼ਨਸ ਕਮਿਊਨਿਟੀ ਲਈ ਲੌਂਗਰ ਟਰਮ ਪਲਾਨ ਤੇ ਕੰਮ ਕਰ ਰਹੇ ਨੇ। ਵਿੱਤ ਮੰਤਰੀ ਨੇ ਕਿਹਾ ਕਿ ਪ੍ਰੋਵਿੰਸ ਦੇ ਲੋਕ ਚਿੰਤਾ ਨਾ ਕਰਨ, ਸਰਕਾਰ ਉਹਨਾਂ ਦੇ ਪਿੱਛੇ ਖੜੀ ਹੈ।
Now you all will have heard the federal announcement of $1 billion for COVID-19 support, and the discussions about how and when that's going to be flowing to British Columbia are still in progress. They're still ongoing. The Prime Minister has stated that there will be an announcement in details tomorrow on how the Government of Canada's economic plan is going to respond to this crisis. You will know that one of the announcements already out there is that the federal government is speeding up the process for employment insurance. But as the Premier has said, our government is also strongly advocating for extending EI, extending the employment insurance program for people who wouldn't typically qualify. So that would include self-employed, part-time, contractors, and we're certainly hoping that we're going to hear that confirmation tomorrow. We're also collaborating with the business community to formulate the longer-term plan. We're looking at the immediate, but we also want to make sure we're looking at the longer-term plan because we do know that our province is going to move into recovery mode. But we're not there yet, and we need to act accordingly. We need to, as has been said by the Minister of Education, heed the advice of Dr. Henry and the Provincial Health Office about the steps we all need to take to care for ourselves and to care for others. I also want to reassure British Columbians that we have a healthy supply chain, that we have appropriate supplies of food and goods coming into British Columbia. The Premier and I had discussions with the Retail Council this morning, and they've assured us again that there's enough in stock right now for everyone. There isn't any need to overstock your own supplies. Doing so will put at risk seniors, single parents, and others who need those necessities. Shop well, plan ahead, but please don't go overboard at other people's expenses. So just to wrap up, I want to finish up again with a commitment that you're going to be hearing over the days and weeks to come. We're committed to working with our partners across the country and working with everyone in the province to be able to weather the pandemic. We're going to remain focused, as I said, on 3 clear priorities: supporting services to protect the health and safety of people, working with the federal government initiatives to bring in our own immediate relief for people and businesses, and building BC's plan for economic recovery in collaboration with the business community.